Hey y'all, Dr. Amanda here. In this episode of Going Live with the Live Well Doc, we sit down and chat it up with licensed clinical psychologist Dr. Joshua Nwosu of Psych and Sounds. This episode, we get to dive in further on mental health, mental wellness, and basically how we can be of a better support, specifically when we think about Black and Brown men's mental health and wellness. Also, how do you even find a good therapist? Where do you make those first steps? Make sure that you share, like, and subscribe. Love y'all real big. So, again, this is our fourth episode of Going Live with the Live Well Doc, where I get the opportunity to sit down with some amazing individuals and talk more about their journeys and professions within the wellness space, but also, too, just how they're operating with wellness in their own life and their own personal journey. So, today, we have no other than Dr. Joshua Nwosu, who is a licensed clinical psychologist practicing in the state of Maryland. After he successfully defended his dissertation, that's big in this culture. After he successfully defended that dissertation, which examined the biosocial theory among teenagers with deliberate self harm, he completed his pre-doctoral internship at Duke University Medical Center and graduated with his master's and psychology. With his master's and his PhD in clinical psychology from Loma Linda University. During his health psychology postdoctoral fellowship at Washington, D.C. Veterans Affairs, Dr. Nwosu provided brief therapy and program development for veterans with HIV and liver disease. And that's amazing. Shout out to our veterans. We definitely want to make sure that we're supporting them for sure. Currently, he works in an outpatient hospital setting and operates his own virtual private practice. He is also the founder of Psych and Sounds, a virtual community for creatives and art fans to learn more about mental health, identify resources, and discuss that intersection of mental health and art. Dr. Nwosu is passionate about increasing behavioral health care access for disadvantaged people, especially those with complex and co-occurring medical illnesses. And I just want to shout out to the world of social media that was able to bring us together and link us together. It's been amazing to see Psych and Sounds, the things that you all have been able to build over there on your platform. And then
Thank you.
also, thank you for supporting the Live Well Doc throughout our journey as well and being a part of the community. So without further ado, I'm so excited to talk with you. And I just want to start off getting an idea more so, Dr. Josh, what made you to pursue a career in psychology in the first place?
Man, I'm so grateful to be here first and foremost. I love watching your live and doing great work here. Um, Man, where do I start? I know that I was actually called by God to pursue an MBA career,
Mm.
and I ran from it like Jonah and pursued a PhD in psychology. No, it was gifting, it was being interested in psychology, and it was being affirmed just by faculty that saw what I was doing and said, "You can do this. You should really pursue this."
Mm-hmm.
All three of those things interacted, and over time, it worked out for me. So I'm grateful for it.
Yeah, I love that. I love that. Especially when that idea of when we see young people that, maybe they even didn't even think about that career. So it was really great that it sounds like you had faculty and mentorship that was able to push you along the way. That's so
Yeah, for
cool.
sure. It's a rare thing. Mentorship is so important, and yeah, I was not really knowing a whole lot about psychology, but
Mhm.
I figured pursue something or learn something that I'm interested in college. And I was actually taking prerequisites to physical therapy school at the time.
Okay.
But I was doing really well in my psych classes, and physical therapy was not as easy for me as psychology was. So pursue what came easy to me as well.
Yeah, yeah, no,
Yeah.
for sure. I definitely understand.
hmm
So tell us more about Psych and Sounds. Like, I know I've been following it, but I definitely want to make sure all of the Live Well community, make sure if you're not already, you need to go follow Psych and Sounds. But tell us a
Thank
little
you.
bit more about your platform there.
Sure. Yeah, Psych and Sounds, it started out of a desire for me to merge my passions. I love music, I love art, I love painting, poetry, all of these things. And I'm involved in these things. I consider myself an artist. I think so many of us in academia, feel like we have to get focused on just the thing that we're doing and only
Mhm.
talk about the thing that we're doing at work. And it's easy to lose sight of who you are in some of these careers because you're so busy and you're working. But I wanted to merge my passions, and it was 2019, and I was in my final year of grad school on internship. Internship is like your residency for med school, basically. Or yeah, like your residency. So
Mhm.
I
Mhm.
was um, I was finishing up, and I was working on my own hip hop mixtape, and I was also studying and finishing up, post applying for postdocs, and doing a bunch of different things. And COVID hits,
Mhm.
and COVID shut a lot of different things down. Um, and I was curious because COVID slowed things down. Um, Bold and curious to decide to start something that would integrate these passions. That started with the desire to just educate. There's a lot of misinformation out there, for lack of a better word, misinformation on psychology and mental health out there. And I felt like music, art is a easy, interesting, and natural way to talk about a lot of these issues. And so I
Mhm.
started doing that, speaking, um, whether it was at church seminars or in my individual sessions or groups. And there was an app called Clubhouse that came out during the
Yeah.
COVID era. Yeah, and I had launched my Psych and Sounds business, and people were joining and supporting us, and I ended up joining a group with other people who I discovered on the Clubhouse app were sharing those same passions, psychologists that also were engaged in music, musicians that were also, engaged in mental health in some form. And so that kind of bolstered my interest and my activity. And long term, I would like to own a studio where I could have
Mhm.
clients coming in and participating and creating as part of their treatment when it's feasible and makes sense. But right now, it's integrating it however I can virtually, whether it's songwriting, now song
Yeah.
analysis, or connecting people with resources. So that's
Yeah,
what
no,
we
I
do.
love that. I definitely, a few things that you pointed out. I think in the world that we live in, especially a lot of times, like in the medical or health space, we are meant to feel as if we have to choose.
Yeah,
Either you're going to be a therapist or you're going to be a doctor, and you
yeah,
need to leave behind the art. That, like, no, like, you're going to use this part of your brain, leave
hmm
that other creative part behind. Like, you're not going to
yeah.
use it. But
Get
I feel
serious.
like, yeah, like it, but
hmm
it's a disadvantage to us, one, as the practitioner, to do that because we're not being authentically who we are. And then it's a disadvantage for our patients because a lot of times too, as you mentioned, when we're able to bring our full authentic selves, including our passions, it helps us to be
Yeah,
able to connect with people.
100%.
So yeah, like I think that's really cool. And another thing that you mentioned, like the dark days, I hit like a PTSD
Ah,
flashback from COVID, like that
yeah,
2019, 2020 Clubhouse. We were down
yeah,
bad. We just wanted
yeah.
some sense of connection.
Here's somebody.
Yeah, but I think that's so cool too, as you said, something that was beautiful, that was birthed out of that, just having kind of the disconnect. So I think that's great too, to kind of think like your own resilience that you were in that space and you were able to build that. So I think that's really cool.
Thank you. Yeah,
Yeah. So, okay, now pivoting. We are just leaving out of Mental Health Awareness Month, and now we're in Men's Health Month.
yeah.
I am curious, and I get this question a lot of times, like even from my patients, like, Dr. Amanda, I probably think I need to start therapy, but I'm not even sure where to start. How do I find a good therapist? So, in your I practice, how would you help guide somebody to finding a good therapist or a good match?
Absolutely. It depends. I'd say if we're talking about somebody that has health insurance,
Mm.
um, I'd say if you pull out that insurance card and call the number and tell them exactly what you want. I want someone that can help me with this. And I want someone that can see me in person, or I want someone that does virtual appointments. I want a black male. I want whatever. Specify it and see what they can match you with, because they will tell you who is in your network,
Right.
that they will cover. You don't have insurance. there are a couple of options. And I know that given the time that we're living in right now, it's different.
Yeah.
Historically, you would be able to participate in research studies or going to universities where there's academic medical centers where they provide, care, um, looking up online. I think now there's so many online services,
Mm,
your BetterHelps and your,
yeah.
some of these websites that offer treatment. I would just say, as you look online, I think that's probably where most people are starting is looking online. I would say you want to specify that licensed or credentialed, clinicians and see that. And
Mhm.
before you start, you ask those questions and make sure that they're legitimate. Don't pay anybody anything until you you know who they are and what they do.
Yeah.
So
No, I
that,
think that is so true. So, just to recap, we definitely want to make sure people are credentialed and
mm,
licensed. So, that includes that. One of the resources I really like to send my patients to is psychologytoday.com.
yes, yes.
Because that would be something where, as you said, all those things like if I'm specifically looking for a Black male therapist who can talk about trauma, you can
Hmm.
actually search that. You can put your zip code on in there. You can also, as mentioned, if you have insurance, you can go ahead and even search that this is my insurance, and to see if they accept insurance, if they don't. And I would also say too, though that's how I found my therapist when I relocated to the DC area. And what was helpful too, she was able to do like a 10 to 15-minute exploratory call with me, where it's
Hmm.
basically her just kind of telling me these are the services that I offer. This is how billing works. So I think those are all good things, as you mentioned, to kind of get that ball rolling. But then, as you said, we do have those services like BetterHelp.com, other resources where you can just be matched with somebody. But I always like to, how do you answer? This is a great question, I think, for people. They'll say, like, I started therapy and I just had that one therapist and we weren't a match. And so they're like, I'm throwing therapy away. Should I even, is it even worth doing this? So how do you respond to those individuals?
Yeah, I understand it and I appreciate where they're coming from because it takes a lot to get to the point where you decide to do that and you went through the trouble of finding someone and they didn't work. Um, and at the same time, it's it's a matter of your health care. I think you have to value your health enough to say, um, this is one person in a really large pool of providers,
Right.
and that person is not a good fit. Does not mean all of them will be, poor fits. Um, I also will say this though, sometimes when you meet with a therapist and it's not going well, you want to communicate that to the therapist. Hey, I don't think this is going well. I don't feel like you're hearing me, or I don't think that this, I thought that it would be this way. It's not. And sometimes it's just a matter of communicating
Right.
and you work on the thing. It's a relationship. I've heard, some of my professors back in the day will say it's like dating. You meet someone, you ask the questions, you try to work on the thing. And as you go and build that relationship, the program tends to get better. I would also say it's hard to determine off of one appointment whether or not
Mhm.
someone's going to be a good therapist. Usually the first couple of appointments are not therapy necessarily. They're more assessment. They're asking you a lot of questions about yourself. And so
Right.
that I would say, generally give people a little bit of time as well to warm up and see if they're a better fit as you work with them. But yeah, absolutely. Don't give up. Don't give up. Continue to seek and see who's out there, and also take note of what you liked or did not like, and try to specify that when you're searching for the next person. Um,
Right, right,
yeah.
right. Yeah, I love that idea too, because I do think that sometimes, especially, I'll see this people of color when we're interacting with therapy. Sometimes we don't feel as confident to speak up, to say the things of like, "Hey, this is actually what I need." Is maybe it's the fear of, I don't even really know what I need, but it's okay just to say, "Hey, this doesn't feel right." And I think too, as we lean more into just feeling that confidence for our own emotions, tapping into that to say, hey, I need something different. I like to make the analogy, like, let's say if you started with a therapist, it's very similar if you started with an ice cream. Like, let's say
Mm,
somebody brought me a bowl of Rocky Road ice cream. I don't like Rocky Road ice cream. That don't mean I stop eating ice cream altogether. I
right.
just got to go to 31 flavors and keep using the little spoons and figure out which one works for me. So I
Right.
think too, like when you approach that with therapy, like that idea, like we might just be taste testing here, but I will eventually find like the flavor that really works for me. So
Absolutely.
yeah.
Absolutely. That's good.
Yeah. So I want to pivot here. We are Men Health Awareness Month, and as you said, coming out of Mental Health Awareness Month. What are ways that maybe men can have that conversation of when should I start therapy? So I think sometimes, within the mental health circle, within the wellness circle, there's so many opportunities where women were dialoguing with each other about that. But how can a man be in a place and decide, hey, I feel like maybe I should start therapy? When's a good time to consider that?
Yeah, it's such a barrier, so many barriers um for men culturally, um, financially,
Mm,
uh, and I think that it begins, for one, if they're interested, then I think that that's a good place to start, but also hearing from other people who decide, hey, I'm going to tell people that I went to therapy. That tends to help destigmatize. It's part of what Psych and Sounds is trying to do,
right.
destigmatize this thing so that men can, feel more confident to pursue it. I also think a lot of men don't know that they need it, and I
Mhm.
think a couple of indicators. I think, for example, talking depression, for example, a lot of people, when they think about depression, they think, oh, it means like feeling sad and down. I'm not sad and down all the time. But when I conceptualize depression, I talk about depression being, meaning reduction. And you can see a reduction in your mood, but you can also see a reduction in your energy levels. Maybe you're lagging. Maybe you're not interested. A reduction in your hobby interest, or a reduction in your sex drive, or a reduction in your appetite, or your impulse control, where you're doing things, eating more than you normally eat, or a reduction in your concentration. Um, all these different areas you can see reductions. And I think that sometimes we will attribute these things or internalize them and say, oh, I'm lazy, or oh, I didn't feel like it. I just want to chill. I just want to be by myself. We
Yeah.
don't conceptualize these things as problems. And I think the people around us are not always conceptualizing these things as conditions. We're conceptualizing
Right.
them as lazy. He's a
Mm,
bum.
mhm.
He just doesn't have it. I'm tired of him. He's immature. He's just gaming.
Mm.
It's like, he's stimming, or no, there's like there's explanations for these behaviors.
Yes.
And I think part of it involves education, part of it involves stigmatization, part of it involves, introducing things that men are already doing that have an
Mm-hmm.
evidence base behind them, which is again Psych and Sounds. We're talking music. People love music. There was a
Mm-hmm.
whole Drake Kendrick beef. There was so much psychology in all of that.
Yes.
I mean, I there's so much to talk about, and I think that the conversations we have,
Mm.
they can come naturally with professionals, and that's kind of where I want to fit in. But again, that's I think a big part of it: education, access, and maybe a mental shift in the way that we conceptualize day-to-day behaviors.
Yeah, no, oh, I think that is so good. So much of what you mentioned, especially that idea that depression, it doesn't always present just I'm down.
Yeah.
So I think too, as you mentioned, kind of that idea of like impulse control. I think a lot of times I'll see it in the clinic where it'll come in, or maybe someone I've had people say, my girl is sending me in, my wife is sending me in
Mhm.
because she's sick and tired of me drinking so much. It's
You
like it's
go.
not, and we start talking. They're like, it's not that I'm an alcoholic. I'm still holding down my job, so I don't see the problem. But it's now that it is starting to have tension in relationships,
Hmm.
or it's
Hmm.
the fact that people participate in the marijuana is legal in places, but it's like, well, no, I started to need this to go to sleep.
Hmm.
It's
Hmm.
and then we get to the conversation of perhaps are we self medicating,
Yeah.
and so I think us being able to have those conversations. But as you said, as the community, how can we best identify that? So that's my question. How can we equip ourselves to be of support, not just for each other in the community, but as we think about highlighting Black men specifically, how can we be of a better support to be better equipped, educated when it comes to mental health for Black men specifically?
Yeah, I think we as a community, um, we got to be patient and show love. We also don't want to um, placate either.
Mm,
And
mm,
I think that sometimes we kind of just say, "Oh, that's just how he is," and that's just
mm,
and that leads to repetition. We dance around people.
yeah.
Um, there's Kendrick's last album, Mr. Morale. He's got the tap dancing in the background. We tap
Mm,
dance around these
mm,
issues, right?
mm,
We don't
mm,
want to address them head on. And I think there are kind ways to be transparent with people and say, hey, you know, you spend a lot of time in bed, and uh, you know, that's not the way that most people want to spend their lives. That's not a healthy thing. Hey, you're not eating. I noticed that.
yeah.
Hey, did you notice that? I noticed that,
Mm,
you usually you'll just have a drink. I noticed you threw a couple back
right.
the past couple weeks, you know?
Mhm.
Um, just communicating what we're seeing with people, um, telling people, hey, it's okay to get help. I think normalizing it. I think that men and women who are going to treatment, a lot of times we say, the folks that oftentimes are in treatment are there to get help with the folk that aren't going. Um, but but I think that speaking about these things in community spaces, whether it's our churches, whether it's our schools, I think that these things can be discussed earlier, more often, so that we recognize the signs. And then just
Mhm.
us as individuals, I think going to therapy um, to get better at being a safer person for the people in their lives
Mm, wow.
is helpful too. I don't think that most people are safe for men to really, share
Mm,
their emotions. Will say, hey, I want a man that's emotionally intelligent and yada yada, but can you receive a man that's emotionally intelligent? If he shares his emotions, if he tells you he's sad, if he tells you, yeah, I was depressed, yeah, this or that, how is he received? How is he treated? Is it reinforced? Is that behavior celebrated, or is it, oh, thanks for telling me, and then later on it's used against us? Or,
mm,
these are self-protecting behaviors that a lot of men are engaging in, and we don't put the shield down unless we see that it's safe.
yeah.
And so I think that these are things that just as individuals we can do. We can better ourselves, make ourselves more safe. Um, that is not to say that that you are the reason or that you're
Mhm.
responsible for this man getting his life together. But if the question is, what can I do to support him? That would be my answer to work on yourself and communicate honestly what you're seeing. Encourage, hey, you can get help. Hey, we thought about this. I think that this would help. Don't dance around it. Um, those are
Yeah.
the things that I can think of communally that we can do.
Yeah, no, I think that's excellent. Just to kind of summarize those big points. One, leading with love. I
Mhm.
think, starting with that, as you said, hey, if we can just be kinder with each other, and kindness does not mean that we're not being honest. If anything, it's the kind thing for me to be honest with you. As you said, we're not going to placate, we're not going to tap dance around the issues. Because a
Yeah,
lot of times, like people say, oh, we have these generational curses. No, we have generational ignoring of issues.
yeah,
Like,
yeah.
we've
Facts.
learned how to behaviorally, like, granddaddy was always like that. Uncle was always like,
Yeah.
no, no. And now it's passing down to your cousins, your sons, your nephews,
Hmm.
because we never really addressed it head on, in love with kindness. And I
Hmm.
love that idea too. Us being honest with ourselves to say, am I a safe person? If someone were to take off the shield, if they were to take off the Superman cape and I get to see Clark Kent,
Yeah.
am I able to hold that part and still not, still hold him still as Superman? even when I get to see him as Clark Kent,
Yeah,
and, even if I know his kryptonite, I'm not going to throw it at him.
yeah.
So I think those are really good things that you pointed out, that we can just do as a community. Um, One of the statistics I recently saw that just really blew me away was the idea this is the first time since we've been collecting data around like mental health and things of that nature that young Black boys and men are surpassing suicide rates than their counterparts.
Mm,
And, anecdotally, I was like, yeah, no, I am seeing that, you know? So I want us to double click in there. What can we do in terms of when we see those signs of like deep depression, even maybe thoughts of suicide? What are the first things, immediate emergency things that we can do to support our loved ones that may be showing those signs?
yeah, yeah. So I saw a statistic recently as well. It's specifically, I want to say it's specifically like 20 to 24-year-olds, if I'm not mistaken, or a certain age
Mhm.
group, that is for Black young men significantly, you know, a higher prevalence now, and it's heartbreaking. It's heartbreaking. I I'm really passionate about access to care.
Mm.
Are there ways to get help, and are those ways easy, clear, simple, um, and frequent? I think that that's important.
Yeah.
So there are signs. There are signs. There are, just from what I my dissertation was in the area. There's difficulties with managing, emotions. There's on an individual level. A lot
Right.
of times there's, invalidation that looks like things in the environment that kind of dismiss those emotions, or over respond to those emotions, or under respond to the point where a teen might not know, how is my parent going to react to this? It's unpredictable. Or
Mhm.
how is this person going to react to it?
Right.
We've got, boys that are in this community culture right now that are seeing, Black people, Black men killed on
Mm.
live, on video,
Yeah.
on their phones. They're exposed to so many, different things in social media, the music, the education system. They're in a time period politically that is, you know, unprecedented, right? So there's so many different
Mhm.
factors that are contributing to teenagers' lives right now. And then they're going through hormonal changes too. And so there's so many factors. There's also, with social media, I think bullying is different than it was when you and I were, younger. You get roasted. It was you and everybody in the class. Now
Right.
it's you and everybody that gets shared on on the
Yes.
on the live. So it's a different level of bullying. There's so many factors. I know that, as a community, we really have to create uh, these safe spaces for our boys. We can't just focus on, as much. It's important to focus on women and believing women and supporting women. And I think that one of the ways that we do that is by teaching men, supporting men, teaching men how to regulate our emotions. I think that young
Mhm.
men that grow up not knowing how to regulate our emotions, it looks like anger outbursts. It looks
Yeah.
like gang violence. It looks like all types of,
Right.
emotional
Yeah.
dysregulation. And sometimes that emotional dysregulation leads to self-harm, non-suicidal self-harm, which can look
Mhm.
like everything from, hurting yourself to more benign, unexpected things like tattoos, like the addiction to tattoos, these things where you can kind of seek to feel pain, or
Right.
want to distract your mind from the pain that you're experiencing on the emotional level by feeling something physical. There's so many different reasons that these young people will try to cope in some of these ways that can cause problems. So, helping us learn how to manage our emotions when we're younger, that goes a long way. I would love to see these things in curriculum. I would love to see these things in um, partnerships with everything from sports programs, barbershops, and churches, and all these areas.
Yes.
All of our spaces, we have a community that is educating, resourcing, supporting. So it's not just left to the parent, but it's literally a village raising that child, right? That's what
Yeah.
I think it would ideally look like. The challenge is money, and challenges, all these other things, these insurance, all these other things that really shouldn't matter as much. But if we can figure out how to do it together,
Yeah.
uh, get those values right, I think we'll be okay. So
Yeah, no, definitely. And just to make sure that people do have that resource, the suicide hotline 988.
yes,
988. So if
yes,
there you ever even have a passing thought, go ahead and call that number. If you are in community with someone and you're not sure what to do, if you are hearing them say they're talking about a plan, it's okay to reach out to that number or 911 because that is an emergency. I say suicidal thoughts is a medical emergency where it is
yes.
okay to reach out. 988, but if you forget that, 911, go ahead and call them too, and give that context there. um, in closing, Dr. Josh, one, I do want to touch and agree, as you said, yes, we hope to see those resources and curriculum barbershops, but I cannot wait. We're claiming it when Sight and Sounds has that studio and that people will be able to come and, create and learn and have that therapy resource there. But in closing, there's a section that I like to do on the Live Well Doc platform. I call it doctor's orders. Basically, it's me giving advice on how we can live well. So I'm going to you already have a prescription pad, but I'm going to turn over my prescription pad over to you. And I would like for you to give our audience a tip, your doctor's order on how they can live well.
Mm. I was sitting thinking about this thing, and there's so many different ones. Uh, you know, we can't change the world unless we change ourselves. Focus on self improvement. If you improve yourself, the people that are around you will benefit from the improvements that you pour into yourself.
Mhm.
It starts with the individual, disperses in the family, and disperses in the community. Um, I think that that's the one thing that comes to mind. And the second thing is say something. Don't stay silent.
Mhm.
It is not uh, it is not tough or strong. I'm speaking to especially to the men here. It is not tough or strong to to contain. Bravery is doing the hard, uncomfortable thing because you know it'll benefit you and it'll benefit the people that depend on you. And that means speaking up sometimes. That means saying, hey, I'm not okay right now. I need some help. I need some support. Um, Nobody wants to be the guy in the gym that put too much weight and crumbles. That's not cool. It's
Mhm.
not cool. If you know the weight is heavy, ask for a spot.
Yeah.
Um, get some help. There's nothing wrong with it, and there are people that are willing to support you. And like Dr. Amanda said, 988, 24/7 mental health support for emergencies, whether it is thoughts of not wanting to live anymore, or it's I really need to talk to somebody, and it's 2 in the morning, and I don't have anybody to call. That is a really useful line to engage in. So
Yeah, so excellent, so excellent. As mentioned, that was a great analogy for all of us gym folks. It ain't nothing worse, but then realizing like midway through, I should have asked for a spotter. This is too heavy. And
yeah,
so, just even with that, in closing, for those of us who are here, allies for men in terms of health, allies for those with mental health, make sure that we're going to be good spotters too. That means we're going to show up for people, that we are going to be able to have real honest conversations with folk. And then we're also going to make sure that we take care of ourselves too, to be of a support. Dr. Joshua, thank you so much for your time today. This is such a wonderful conversation. I need everybody to make sure that y'all are going over to follow Psych and Sounds and supporting the work that they're doing there. Until next time, thank y'all so much. Bye bye.